My name is Bob Farrington, 66-year-old grandfather, father, husband. My occupation is basically chauffeur, stroke driver. I've been under the chest clinic for quite a number of years with Dr. Lee Camlois. Always had exceptional treatments, monitored very, very well by Dr. Lee Camlois. I've got a great deal of respect for him. And when I'd had one of my consultations with him, a few weeks later I started to cough up blood. Dr. Lee Camlois then sent me for CT scan. Whilst on holiday, I got a phone call to say that an abnormality had been found within the pancreas area. They then sent me for an endoscopy, took some samples, and that's when I was given the diagnosis of cancer of the unknown primary. From there, the treatment originally I was given one set of treatment. Then, when they found the primary, the treatment plan was changed. A little bit apprehensive, a little bit worried, a little bit scared to start with. But after the first treatment, the staff on there were very, very helpful. They made you feel relaxed. Diane, who runs the unit, or she was when I was going, I couldn't fault her. She was such a lovely, warm person who really looked after all the staff, but also the staff as well. Always had a smile on their face. They were always, "Are you okay?" Constantly checking to make sure everything was fine. My appointments was taken up on Halloween. Decided along because my youngest granddaughter, who we call my wig expert, chose a wig for me to wear on that particular day, which was a long wig, and then a witch's hat that when you press the button on it, it played "I am the witch doctor." That brought a little bit of humour to the staff and to the other patients receiving treatment in the unit. The next thing was just before Christmas, I had a Christmas pudding hat, a pair of glasses with thick white eyebrows, again came into the unit, and a lot of the comments were, "Well, what are you going to do next?" I just think by doing something like that, it lightens it, it makes maybe other patients feel a little bit more comfortable, a little bit less stressed. After you've been given a diagnosis, we were taken to a side room with a clinical nurse specialist who had a little bit of a chat, told you, some of the things you could expect. I think there should be somebody along with that to be able to give out information and is a little bit more knowledgeable. I wasn't given any information on diet. I wasn't given any information on hydration. I was told roughly what some of the side effects could be from the chemotherapy. It's impossible, I think, for a clinical nurse specialist to do it because she's got so much on her workload as it is. But somebody may be independent, or somebody that's got a little bit of knowledge that can turn around and say, "Right, okay, this is what's happened to you. There's a leaflet for that one, there's a leaflet for that one. If you read it, if you've got any questions, come back to me." At the moment, that is all put onto the clinical nurse specialist. Whilst I was told I can phone her up any time, I just felt that sometimes what was happening was I felt I was taking valuable time of hers because she had other patients to deal with, she had clinics to deal with, and I think it needs to be taken away from the pressure taken away from that clinical nurse specialist. An appointment with somebody on a separate day, away from the diagnosis, maybe 2-3 days later, or maybe a week later, once you've had time to digest what's happening. Especially in my case, where I was told it's not curable. It would help if there was somewhere where patients, just patients, could get together and be able to discuss between themselves. Maybe if, a meeting once a month where patients could be invited along to just sit there, have a coffee, some biscuits, have a chat and share things. Because one of the things I did find, and it's very unusual, that after the treatment I'm now suffering from peripheral neuropathy, that in Germany what they do, they give people a piece of artificial turf and rub their feet against it, and I've tried it and it works. A group of patients in a room, you can turn around and say, oh well, I'm suffering from this, I'm suffering from that. Oh well, try this, try that. It may not work for everybody, but at least they've got access to, right, well, somebody's actually tried that, somebody's actually done it.
Hello, my name is Grace Easton Gillespie and I'm the Acting Ward Manager of the Haematology Oncology Day Unit. Thank you, Bob, for your patient story. It was very positive feedback and I have taken it to the team. We have taken on board the issues that you've raised, and we will look into that and see how we can make more improvements to make patients' experience a lot easier. Also, I did notice that you had a little piece of artificial grass. I think that's a really brilliant idea, and we will take that back and discuss it for patients in the future to see how they find using the artificial grass for them, if it helps. So thanks again, Bob, and it's really good to see that you're looking very well.